professionals on this platform, Own Your Growth. Own Your Growth is a wonderful platform, and it gives you to get in touch with people, I believe, with various experiences. To talk about very shortly about me, I graduated in 1995, and this August 5th, I'll be completing 30 years in the field of naturopathy, 30 years. And as a professional, I will be completing 25 years in a system of naturopathy because I graduated out in 1995. In this 30 years, as a student, as a professional means I was both a teacher as well as a clinician. And I would like to share my experiences regarding both as a teacher and as a clinician. So my talk will be divided into three aspects. The first one will be what are the qualities you should expect in a person with as I see it. It is not the scope which normal people decide and tell. As I see it, out of my experience, I see the future. What is the scope as I see it? And the third part is what is the importance of quality? What is the importance of involving quality, that is NABH accreditation in naturopathy? Because I'm one of the few assessors in this system. It has done a lot good to me. First of all, let me begin with my early student life. My early student life was very simple, jovial, very naughty, and all those things are there. But as I went on to the second year, third year, and mainly the final year, I don't know, we had a very good quality teachers who shaped us and made us look into the life in a very, very positive manner. And after that, if you look at, I have worked in many places. The first place I worked was SDM, where I served for almost 9 to 10 years. So in SDM, what I learned was, to put it in a nutshell, I learned what responsibility was, how it was to be responsible, what and all was entrusted to you, and the level of responsibility the people give to you once they have confidence in you. That was what I learned in STM. Then after that, there was a small gap where I started my own practice, and it was under my uncle. As I started the practice, there I understood what was the importance of maintaining the responsibility and relationship main relationship with the patient. He was an old RMP, but the amount of patient he used to get was 130, 140 patients on an average per day. So there I understood what was the patient-doctor relationship. Then afterwards, I went up North India. There I knew what power was, because the MD of Kerala in Kailash Institute of Naturopathy given me the full executive power to take any decisions. So I knew what power was. Then when I came down to Sant Sundaram Yoga and Naturopathy College, I learned what service is, because that was a hospital which was built up based. The main function of that hospital was to serve people, and the cost of the treatment, where when I started working there, you may find it hard to believe, was average 40 rupees per day, right? So that was the amount of this thing, amount of money they used to take per patient. Then after that, I came down to Alva South. There, I knew how difficult it is, even if you work hard. You are to be blamed. I have gone through difficulties, but learning through the difficulties was never a thing for me. But I understood how it is to be get blamed even for the things you have not done. That is maybe a negative aspect, but I see the positive aspect in that also. Then lastly, now I'm settled. I am in Andhra Pradesh. Here, I know what the full authority is. Every management, when they give you a post, they come with an expectation. Very rarely you get to know people or get to work with people who don't expect much from you, but expect to work for the quality. And here I was able to see that. So this is a very, very short journey. This is my journey of 30 years in naturopathy, very short, in short, right? So this is how I sum up. Now, I told you my talk will be divided into four groups, right? The first one for students. As a teacher, I was never wanted to be a teacher. In fact, I never wanted to. But I was pulled into this profession by one of the senior most uh, head of the Department of Medicine, Dr. S. N. Pandit. He asked me to apply for the job. At the time when uh, I was doing my degree and graduating out, we did not have options for job. And I had very few limited option, and I just went in with his advice. And from there, my interest in teaching began. And I have been seeing many batches of students. I had seen almost 20, 25 batches of students coming out in different states. And I find there is a lot of difference in the way we studied and when the way you people are now acquiring, or now you people are getting into the field of naturopathy. I remember the early part of my life, we used to struggle to get one book. But nowadays, for example, if it was physiology, we would never had a textbook of physiology of our own. We used to always ask the librarian to supply. There was one or two books which we used to share among 24 of our batchmates. And this is how we studied. But now that is not the case for you people. Each one of you have mobile, laptop, iPad, everything. And each of this book of different authors can be downloaded into your book and you can read. Uh, but what I find precisely, hope I'll be blunt with that, the amount of reading is not seen as it was previously. Uh, to put it in a very correct way, you should read for knowledge sake, not for exams. And nowadays, it is very, very, very clear that you read only for exam sake. And once the exams are over, once we ask the questions regarding the same, it is very difficult for you to give the answers. So this is one part of it, which the student should look at, read for knowledge sake. And the more you read, students rely more on notes. Notes are not everything. Notes are just what the teacher read, and he is just putting out what he knows. But if you read yourself, that should give you a lot of knowledge. And mind you, the knowledge you acquire through the reading will give you, will be there throughout your life. uh, the problem with the present education system is that you have everything in reference, and everything can be got on your fingertip whenever you want. You need not search for it. But the negative thing of that is that you have forgotten the art of searching. If you search and read through books, that would be much better. So this is regarding one aspect, acquiring knowledge. Second one is self experience. See, there are many students who call up to me and ask, sir, how to give the enema, or what are the difficulties faced during certain treatments. This happens because there is no self-experience. If self-experience is there, you will never ask these things. And of course, the colleges definitely will provide you this opportunity to experience the treatment self. But we think escaping these experiences is a credit for us, and understand that self-experience is the best teacher. For example, when you try to understand what is fasting, unless and until you experience the fasting, the craving you undergo for the second and third day, and the peace of mind you have on third day onwards, you will you'll never be able to convince your patient. So this is another important aspect, self-experience, which the student should have. This should be experienced by the students. A third thing for a student, developing communication skill is very important. See, it is very easy to see a doctor taking up a case history, and after that he come to the diagnosis. But communication skill are to be developed very, 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 very strongly by the students, because the entire naturopathy is that system of medicine which requires very strong communication skills. If you are not in communicate with the patients, he will not be able to express the problem with you. And many times you misdiagnose and mistreat. So actually, when you see most of the problem which people face nowadays, particularly in the younger generation or in the middle ages, are most of them are psychosomatic. And if the communication is proper, you'll be able to extract out the history and treat the problem from the root cause. If the communication skill is not proper, what happens is that you try to attend the patient's complaint superficially, which is not a good idea. You may you may end up treating a complaint. For example, a person who has back pain will be having some psychological problem which is not able to explain. So communicate it properly, understand him, get him into confidence, and then. So this communication skill is the third skill which you should develop. Then confidence. See, this I see particularly in the exams. You are very, very, very nervous during exams. See, examiners are there just to test you. Very rarely there are examiners who are there to fail you. Most of the examiners are there to test you. And during the process, if it all depends upon how much confident you are in answering the subjects, and how much we don't go into how much you know. First, we know, as an examiner, I have seen all this 25 years as an examiner, I would like to look at how confidently you answer, and then I go into your knowledge, right? So confidence is another thing the student should acquire, and to have the confidence, reading is important. And to have confidence, self experience is important. Proper this thing is important, communication skills. So everything is interlinked. So be very confident and acquire this confidence. Until and unless you acquire this confidence, it is very difficult for you to practice the system of medicine. Then uh, there is some things, student life, young blood, there will be a lot of fun. So there is something called as naughtiness and something called as crookedness. To put it in a very simple word, naughtiness is an innocent expression of wrong, and crookedness is innocently covering the wrong, acting innocent. That is how can I put uh, naughtiness and crookedness. So naughtiness will be appreciated, but crookedness will not be. Because, for example, when you break the rule, the normal answer is, "Sir, I did not know it." That's all, right? And you try to beat around and try to put the blame on others. So in naughtiness, in crookedness, you never accept the mistake and try to avoid. But in naughtiness, you ultimately accept the mistake. So naughtiness is accepted, but not the crookedness. And ultimately, if you are naughty, that will be appreciated. Then the last aspect is enjoying life. This I find very, very, very less about among students now. If you talk about enjoyment, we used to enjoy life like anything in our college day, and maybe past up to 2008, 2009, I've seen people enjoying life. But nowadays, it has been more common that I see very less people going out to play. They are more interested in the mobiles. They are more interested in in chatting rather than physical involvement in games. They are just involved in other things. So you should learn to enjoy life. So these are the basic tips, or these are the basic things the student should look at and enjoy student life and come out with flying colors. This is for the students. And apart from the students, there are certain qualities to be developed, even for a practitioner, as well as when you come to the internship. Internship is the next phase of your student life. So internship, you are a doctor, but without having the right to put the DR, that is alphabet in front of your name. This is what you are, right? The first thing you should learn, both as a student, as an intern, as a practitioner, is presentability. You should be presentable. By using the word presentable doesn't mean that it is mainly how you are approaching the patient, how you are presenting yourself to the patient. Normally, nowadays we find beard, jeans pant, and in ladies you go with tight dresses, high heels. See, the presentability makes more important things. It gives a statement. The when you are into the profession, when you are on duty, try to be more presentable. Try to try to see that try to see that you will you will be as a doctor, not as any other thing. An engineer can go with jeans pant and t-shirt, right? That is not going to affect his profession. But the same way, if the doctor goes with a jeans pant and t-shirt, that definitely has an effect on his practice, and an effect on the patient's the patient's perception about you. So be very careful about presentability. I remember my sir, Dr. Y. Rudrappa, always used to be very presentable. And there were two things which I noted. So when he used to come for duty, he used to come in a perfectly dressed pattern, and he used to come for duty on Sundays also. In that day, he used to come with dhoti and shirt, right? That is very clear that the office people should not give official work to him, or that is his off duty. And so this is how it gives a signal. So your presentability or your attire will definitely give a signal to others also. The second one, the most important quality of a doctor is punctuality. You know, punctuality is one thing which we don't give much importance to. And I don't know, I had been developing this mm, punctuality from long back. And from my student life only, I tried to be before in the class, I tried to be at the possible earliest, so that I tried to be comfortable there. Even for exams also, I used to be there. But um, I never knew its value. I never knew people were observing. What happened once was that when I left Dharmasthala and I was practicing in my place in Ankola, that is in Uttara Kannada. There I had to, just was marriage time where I had to run about, and I was driving back to this particular place, Ankola, the clinic. I was driving back, and on the road I saw a person, a familiar car. That was my boss's car. So I stopped and stopped to say hi to him. Immediately he spoke for some time. Then he asked me, what are you doing? Where are you? Then he told me, I told I'm working in such and such a clinic. Okay. At what time your clinic opens? He very casually asked. I told it opens at 5 o'clock. He looked at his watch and told, it's already 5:15. When you are working with us, there you are very, very punctual. What happened to you? Means your punctuality will be observed, right? You may not knowing it. And being punctual will save a lot of time for your doctor, for you as well as your patient. Another incident was there in Noida when I was working. There, the senior district magistrate, we call them as SDM, was one of my clients. He used to come there, and there was a particular time where I given him an appointment. And normally, the senior district magistrate usually comes on time. Usually, the senior government officials, they don't come on time. But this person was there early by 10 minutes. Then he asked our manager there asked him, the senior manager there asked him, sir, you could have come a little late. Doctor will be coming. He told very clearly that doctor will come. I know. He is here by 9 o'clock, before 9, and I don't want to waste his time. So when you respect when you give respect to the patient's timings, the patient also will respect you. And however high he may, but it is not the case in everyone, right? The third quality which is expected in a naturopathic doctor is patience, right? So patience, once again, you should be in patience, I would like to tell you should be a good listener. If you are a good listener, there are a lot of things which will come about. And most of the patients wants you to listen, because the problems they have listened, they are told to many doctors and they found the solution. But there will be no one to listen to their problem, right? So you should be a listener, and being a listener will help him to be confident with you, and he'll be giving you so many clues that will help you to to get a better understanding of his problem. So be a listener, because naturopathy is that system of medicine where most of the thing is done by talking. And if you talk, the patient talks less, you'll miss a lot of things. So allow the patient to talk, be a good listener, try to stimulate him to talk, and just find out, get to the base of the problem. This is what is ultimately required by you. So patience is a virtue which you all should develop as a naturopath. That I strengthen them. I see one of my teachers, Dr. Y. Rudrappa, is a very, very, very patient listener. However hurry he is, however difficult time is, he never ignores or never tries to overrule a patient. The same way I've seen the allopathy practitioners also, where they are in hurry to dispose of the patient at the possible earliest. They don't waste time, right? So time is money. But in our system, it is not money. It is much more than money, because you have to develop the confidence in person. The next thing is perseverance. So perseverance is one thing which perseverance is one thing which you should develop. This category or this quality is can be developed in many ways. For example, it comes with the basic example I can give you is regarding the treatments, right? When you talk about treatments, what happens is that the patient will come and tell, you'll write many treatments. The patient will be there to see for their pleasure. But if you are continuously, for example, hip bath, the patient will always feel what hip bath will do. I want some massages. So this is how. But you should be persevere and persistent with that particular treatment. That will definitely give you result. So most of the thing I have seen the young doctors, what they do is that they keep on changing the treatment, because in allopathy, for a simple acidity, they have so many medicines. Right? They are ranitidine, they have so many medicines. They have pantoprazole, they have rabiprazole, they have so many this medicines. But for us, we have very limited treatment. And this limited treatment, if it is given in a repeated frequencies, that definitely will give you result, right? So you should develop this particular quality of perseverance and persistence, rather than with perseverance, persistence, and that will definitely yield you good results. Then observation is another quality which you should see, you should develop. Observation as a physician, see, there are so many things which has to be observed. Normally the person comes to you with a lot of complaints. And these complaints may be relevant or irrelevant, or sometimes some people wants your attention so that they hide what is their actual complaint or try to mask their complaints and present it to you till no what changes has happened to them. So you should be able to observe that. Observing skills are, see, observe the patient in presence, in their absence, without their knowledge, right? You should keep on observing. For example, I give you a very simple example of a person with sciatica. He comes to you and tell doctor, my pain is so bad I cannot walk. His face tell that, his experience tell that he is not able to move his body parts. So this happens in your presence. But if you believe that that is true, you should, you may be wrong. The moment he gets out of your bed and walks out from your chamber, and just after a few steps from a chamber, he starts to walk normally. So this means that you will be wrong. So your observation skill should be there. Where the patient is, without his knowledge, you should be observing. In observation, with knowledge, the patient may tell several things. Okay. The next quality which I feel a naturopath should have is a sense of responsibility. Responsibility is a very huge word. We always feel that our responsibility is over. This is what the common sentence we hear from everyone. But I'll give you a simple example. I was with SDM. I was working as an decoder for examination question answer papers, and one of my colleague mixed up the decoded papers, and these decoded papers do not have any other way, right? So, but our principal, Dr. Vittal Sala, at that time, so he came, though there was a superintendent, so he was not in charge or he was not in any way responsible. He came, he sat with us the entire afternoon, tried to sort out things, cleared the things, and went. He could have easily told that is not my responsibility, get it, set it right. No. So, a good leader, a person who is having a good leading capacity should always own the responsibility. The responsibility is one thing. And responsibility, once again, I told you, in Dharmasala, I learned what responsibility was. So, uh, once again, a small example. In Dharmasthala, I was very interested in this stage and stage preparations and decoration. For most of the programs, when I was there, I was in charge, right? It was for college day preparation and all these things used to be arranged by me. But there are two occasions where the boss called me and asked me to take charge of a big function that was opening up of a new block as well as the present college building. Initially, I was not that confident, but the boss told, see, small functions and big functions don't differ. I have seen you, you will be able to do it. That's it. So they give the responsibility to you once they observe that you are responsible. So responsibility is one of the this thing, character quality you should develop. Then the next one is dedication. So dedication, once again, there are a lot of meanings for it. But in what I want to actually tell you is dedication means you should be a karma yogi in your field, right? Karma yogi, you cannot be a complete karma yogi, at least a partial karma yogi. Dedication means, uh, I see in most of the colleges, as a lecturer I have seen, as a higher official I have seen, as a principal I have seen. The college is supposed to get over by 4:30. By 4 o'clock, the staff pack up the luggage and keep ready. At 4:30, they will be out. When there is a holiday, at the end of at the beginning of every new year, they calculate how much holiday they have, how much Sundays they missed because the festival came on Sundays. So all these things are there. So dedication is one of the quality which has to be developed by you people. Dedication is one sense, in one sense, try to go beyond your duty hours. Never quantify your work. That's what I want to be precise with. Never quantify your work. See, most of the time, people say that we come on time, we go on time. That's right. Legally, you're right. But some of them tell we came on time. Today we are going half an hour late. Tomorrow I'll come half an hour late. So this is what I am precisely talking about. So half an hour late, if you are doing, either you are doing a service to someone or it is going to help you indirectly, right? So this type of dedication, it should be there. And I have seen this dedication in, once again, in another one of my sir, Dr. Y. Rudrappa. Dr. Y. Rudrappa is a very dedicated person. I have seen him coming on Sundays also. And another person whom I have seen very dedicated, particularly to subject and hospital, was Dr. B. Prabhash Kumar, who recently passed away. Very knowledgeable person. And he was dedicated. Whenever you ask something, it is not only regarding the subject, it is not only regarding the hospital, regarding any subject, he would dedicatedly call up, even though after nearly 20 years of leaving the college, he was my go-to man in any cases of respiratory problem. I used to call up to him and ask regarding the complaints or regarding, because I know this person reads a lot, right? So this is dedication is another one important aspect which you should develop, right? Then then after that, relationship. So relationship with the patient is very important. So relationship with the patient, once again, it includes how well you are gelling with the patient, right? Means I had seen this in my uncle. Relationship. What is the relationship with the patient and the doctor? uh, he used to get calls for home visits. That time it was a tradition to go to home visits from place 100 kilometers away from the place of practice. And he used to go. Sundays he used to go. I had been many times with him. So I seen that relationship. And to be very frank with you people, I have seen that most of the patients I have been carried on from where I was, right? From where I was, I have been carrying on the patients. That is, wherever I moved, the patient I moved with me. So this is because of the relationship I have developed with the patient. There presently a patient in Japan whom I had treated him for the back pain, and he was very convincingly treated that for every movement or every health issues, he calls up and asks me. But keep it a point that you should never try to deny your service to any patients, and that will help you to develop a very healthy relationship. Then, of course, humbleness is one of the qualities which you should be expected in you. Humbleness will teach you a lot, and that will reflect on you a lot. Then, convincing capacity. I have seen this quality in many people, particularly I have seen this in, once again, Dr. Y. Rudrappa. He is able to convince any patient. And slowly I tried to put the same thing into my practice. I found wonderful results. So convincing is not by forcefully telling about the system. Slowly agree to them, then slowly try to disagree to agree, and then they will listen to you. Then one, this is how you are going to convince the patient. Then be scientific in your approach. Be very, very what you call methodical in your approach. Automatically, you can convince. You take the scientific background, you take the results, you talk about the results, you talk about the patient's problem. Automatically, the patient get convinced, right? Explain each of the treatment, how it is going to help. Automatically, the patient will convince, particularly for fasting. Then, of course, knowledge, I have already told you. Then confidentiality. This is very important. So, as a patient, the patient expects there are certain things which the patients expect, right? The patient expect you to keep it confidential. There are so many cases whom they come and want to tell certain problems which are there deep inside them, and they will tell to you only if they are confident, right? Only if they are confident, and this confidentiality will not come overnight, right? They should be first able to believe in you. In such cases, what happens in regular practice? In a hospital setup, everything is okay. They will be 10 days in touch with you. But in outdoor practices, I have seen this, when you keep on talking to the patient, right? They keep on calling you back and they start to tell the problem, and you just keep on inquiring about the health. Then just don't show too much interest. Normally, when they are convinced that they can tell things to you, this thing can be achieved, confidentiality of the patient, and to get the confidence of the patient, and to maintain the confidentiality of the diseases or problems which the patient have. So these are few of the characteristics or few of the traits a naturopathy doctor should have. And apart from that, there are some things called as alertness and quickness in thinking. This is one quality which you should develop: alertness and quickness in thinking. Normally, this happens whenever you are facing a problem. For example, suddenly a disease like Huntington's chorea comes to your mind. What are you going to do? You are not aware of that at that particular point of time. You don't know what how are you going to manage that. You don't know what the problem is. So in that case, it is very difficult to tell I don't know, because a doctor can never tell I don't know. So you should have a quick thinking ability to come out of the problem, convince the patient, have time to refer, get back to him with more knowledge than he has. Because nowadays patients have a lot of knowledge than us, because they have to refer only about one problem, and they refer about one problem, right? But we have to refer about so many problems. For example, there was a condition called as Tourette syndrome. I don't believe anyone has heard about that. Tourette syndrome, where the person, it was very new to me, and I could not tell anything. But I told this thing can yoga can help, beating around the bush, and then afterwards referred to it, found that it was not treatable, and maybe probably with naturopathy it was difficult to be treated. So I discontinued with that. So that's how quick thinking will help you. And also in certain conditions where quick thinking is necessary, right? Uh, I have short of time. I cannot go on like this. So I try to avoid the details. So these are few characteristic features of rather than characteristic features. These are the few qualities every naturopath should have, so that they can become a good doctor. You don't have a single role model. You see these qualities in different persons, and this different person, you should be able to acquire this quality and present yourself, right? So then coming to the uh, next important thing, that is scope. See, I don't want to tell that naturopathy has that much scope, this much scope. I'll be very, very precise with the scope. See, telling naturopathy is a good system of healing is one aspect. Practically, COVID crisis is a blessing in disguise for us, because in COVID crisis, we have seen how the hospitals during lockdown were empty, and people were not attending the hospitals, but still were healthy. The death rate had reduced. The same thing happened, I think it was in a country like Israel, when the doctors went on strike, and the coffin makers has to bribe the doctors to come back to duty, because the death rate has reduced. So it is very clear, medicine is not an important part. We try to force ourselves to medicate, and this is going to hurt us very badly, right? Then in COVID crisis, we have seen how people have changed, or how people have modified their this thing. And I find most of my students modified themselves, their practices, online yoga consultation, online yoga practices, because naturopathy is that system which doesn't requires medication. It just requires advices. So confidently you advise, you have a patient, right? So online consultations were there, online yoga classes were there. Then so the COVID crisis has really taught us our scope is unlimited. The second thing is that we are always worried about Ayurveda and allopathy, their influence on our system, and they are trying to subdue us. Right? They are right. They have their own way. Ayurveda and naturopathy, Ayurveda and allopathy. See, first, if you go into the history of medicine, first, almost a system like naturopathy began, then Ayurveda began, right? Then homeopathy came into existence, and lastly, allopathy came into existence. And past 150, 200 years, it is flourishing. And now we know that there are it is on the downslide. It is not that important. People are now turning on to the alternative system of medicine, as you people know, right? Now, picking up the second part of it, Ayurveda. Ayurveda is one of the best system of medicine, but the catch is that Ayurveda, the future of Ayurveda is not as good as we think. The reason is very simple. The medicines which are there are not of the quality of medicines which are expected of them. For example, you want to get preparation Ayurvedic medicine, Dashmula, there are 10 herbal ingredients which has to be integrated and brought. But you don't get, because you get the forest people try to obstruct. In previous olden days, this was not a problem. For example, there is something called as Pravala Vasma, which is made out of this, what you call, Pravala is that is in the sea. You have the coral reefs. So these coral reefs, they don't get the coral reefs, so it is not. And there are certain medicines which require animal ghee, which is not been purchased, which is not been done. And nowadays, so I don't see the future of Ayurveda as bright as what they are projecting, because that I have seen. Basically, I am from an Ayurvedic background. I know what it is, and I seen the efficacy of traditional preparation of medicine, and I have seen the modern preparation of medicine, and I have seen the results also. So I don't see Ayurveda as a potential threat. But only thing is that we should prepare ourselves for a better presentation and come up with treatments so that we will be able to present ourselves better. Right? Then coming to homeopathy, homeopathy is a treatment which is going to survive. The future, once again, as Thomas Alva Edison told, the future is diet and diet prescriptions, homeopathy and surgery. It is not allopathy medicines, not even Ayurveda, right? So we need not worry much about our scope. We need not worry much about our future, right? It is going to come probably maybe in another 10 years time. You can see the change. Nowadays only you have seen there is a shift in government policy. Though the Ayurveda lobby is trying a lot, we are trying to come back, and we'll come back strongly. That I am very confident. This is very briefly about the scope. And I take Bhavit,
Sir, yes, sir.
can I have 2 more minutes?
Sir, for sure, and your video is stuck, sir. Anything is there, sir? Your video is stuck, sir.
1 minute.
I do not want to disturb sir. Incident.
No, it's continuous. Is it okay
Now
now?
it, yeah, yeah, sir. It's clear, sir.
I have kept them this thing. Okay, fine. So I'll take another 4 minutes to tell about NABH. Right? See, NABH is national. 1 minute. Now it is clear. Video.
So your face is like your video is clear, sir.
Okay, now.
Yes, sir. It's clear. So you are projecting something, sir. Any
No,
PPT or
no, I'm
something?
not presenting anything.
Yeah. So then it is clear, sir. Then it is clear.
Right. Okay, fine. So you understand what is NABH. So NABH is National Accreditation Board for Hospitals and Healthcare Providers, right? And it constitutes of a Board of Quality Council of India, which is set up to establish and operate accreditation programs. You understand what is accreditation, right? So accreditation is nothing but an official approval of an organization, right? And we have certain standards of it. We have something called as accreditation standards, means there are certain expectations from the this thing NABH that people require to the hospital required to get qualified for this particular certification, and the standards are directed to deliver quality health care and services. So this is about NABH accreditation, right? Then coming to I don't want to know go into the definitions of quality. You understand? I just want to I'll just go into the benefits of accreditation. So by benefits, the NABH accreditation benefits the patient, the hospital, and the organization, right? So and in the form of patients, the benefit of the patient is that they get high quality patient treatment and safety, because quality treatment, quality care assures safety of the patient. The second one is that the service provided by the system, by the staff and the hospital is of a high quality, right? Then the benefits, the third benefit is that the patient knows exactly what are these rights and what is the bill, what are his rights, what are his duties, and what are the details about there is no hiding about the cost, there is no hiding about his complaints, everything will be told openly to him. And it recommends patients what you call satisfaction, right? So that the patient will get satisfied, and he may be able to get better treatment, right? The benefits of the hospital are it improves your there's a scope for continuous improvement. Then it enables to give quality care, right? Not only the hospital, the entire hospital staff is getting this thing. Then it raises the confidence of your hospital, confidence about your hospital to the public, right? So when you have an NABH accreditation, that is to be understood that you are giving quality treatment and you are certified. So it raises the confidence, and it also provides to benchmark quality also, because quality is one thing which goes on improving, right? As for the staff, right, the hospital staff, once again, they are more satisfied, and it provides a continuous learning working environment, and without discrimination. Then it helps you to teach, to be frank, to be open, and to be to what you say in your clinical practice, and not to hide things. NABH accreditation is not an inspection. We come down, we try to find out, look at your hospitals, we look at your hospital documents. Once the document is seen, we go around the hospital and see what all you have said in the documents are there in the on the site. For example, about treatment, what are the care taken, how the tub is washed after each treatment. Then if there is any fault or any mistake, we try to note down it as an NC. Then further, once again, give a scope to revive it or to correct it. We also even sometimes uh, it helps. We give advice to the patient, to the healthcare organization, to improve the quality also. We give the advice or we suggest some things, right? So this is it. And who all can apply, right? There are 10 standards in this thing, what you call NABH. 5 are patient-centered standards. I don't have enough time regarding that to explain that. And 5 are what you call hospital-centric standards. And coming to who all can apply, any hospital can apply, any clinic can apply, anyone who is interested in quality can apply. So with this, I think I have been hurrying up in the last part of time. I'm very sorry because I think I have chosen a huge topic, but I think I have effectively conveyed to you what I want, right? And anyone who is interested in this NABH, can contact me so that I can explain to them in detail, either in person or through mail. Thank you. Thank you, Bhavi. And thank you for for this particular platform, Own Your Growth, for giving me an opportunity to interact with many of the budding naturopaths, and hope my input should help you in some little way. Thank you. Thank you very much.
So thank you so much. And there is few questions if you
Yeah, please.
take, sir. Yeah, sir.
Yeah, please, please, please.
Yeah.
I'm ready
So
for that.
yeah, so first question is from Vinay Kumar T. After undergraduate BNYs, what do you think one should go for PG or job? Because many say that we have very less to learn in PG, and how to deal with the people who have diploma certificates and dominate on us. So,
Right. Vinay Kumar, just understand that you should have a very clear cut vision of what you want to do. Normally, you go for PG if you are interested in teaching or if you are aiming for a government job, right? If and Right now you can go in for PG even for clinical practices also, but I don't recommend that. If you are only going for higher studies, you can only go for higher studies if you are very confident that you want to go into the teaching field, research field, and all the other things, and government jobs that will help you in promotion and to get a good job placement. The second part of the question, and I'm not denying that you should not do as a clinical person, you should not do that. All depends upon you. Second thing is that the unqualified people, certificate holders or diploma holders, see, diploma holders are more confident than us, right? That's why they flourish. The moment you get confident, no one can shake you, no one can touch you, right? So you should develop that confidence. And nowadays there are legal routes where you can tackle them if you are very confident about this particular things, because in Kerala we have seen so many cases happening where they are put behind bars, right? So Vinay Kumar, don't worry about that.
thank you, sir. And second question from Gautam. Sir, do we have opportunity for practice under state government, Telangana? How can we apply?
Telangana, definitely there is a government college there, right? There are NRHM schemes, and it is, the possibility is there. The thing is that I'm very new to that part of the state. If it is Kerala, Karnataka, and Tamil Nadu, I can tell you. In Andhra also there are postings, and since naturopathy has originated in Andhra and it is a divided state, I think there are practices, there are posts in Telangana also, since it has a government college and a government hospital. There are posts. Only thing is that you have to dig in and just find out.
Yes, sir. And there is a compliment from Dr. Rakesh Gupta. Like, nice to hear you after a long period of time.
Rakesh is my student from SDM.
Yes, sir.
I remember him. He's from Rajasthan.
So, any other questions are there which will take like in 1 or 2 minutes? You can unmute and talk to sir directly, or you want to write in chat box. That is also fine. So, however you want, we'll wait for 1 minute. Any questions regarding accreditation or any of your future journey or experience? Anything?
I'm ready.
Hello, sir. Good evening.
Yeah.
Uh, Sir, I'm Bhoomika from Government College, Mysore.
Yeah.
Sir, there are some people actually who doesn't trust this system, sir. Being in this system, they don't trust this. I have noticed few students, as per my knowledge, I have noticed few students. They also try and blame this system and all, saying within this. And I need your comment for this, sir, because since you practice this naturopathy for a long time, I want I want to like I just want your opinion what to tell them, how to convince them, because they are already a students of naturopathy. They know
Okay.
what is naturopathy, they study
I
about
understand.
this, but
I
still they
understand.
don't believe this.
I understand. I ask you, madam, do
Yeah.
you believe in God?
I I believe
Do
in
you believe in
positivity,
God?
sir.
Huh?
Eh,
I'm asking you a
I
direct
believe in
question.
positivity.
You believe in positivity. Okay, you believe in positivity. So with positivity, negativity
Yes.
is also there, right? There are germs in our system
Yeah.
and there are germs in our system also, right? And these germs develop because they
Mm.
don't have confidence. They are not able to develop, and they try to put the blame on the system because they are not confident. This is what I was telling you. If you are confident, you will never do this, right? So this is what has happened. And
Yeah.
it is unfortunate that these people cannot be corrected, right? Because it is not only you. I have some of my senior batchmates who are there, who are
Mhm.
blaming the system because they did not succeed. But I have seen so those people who have succeeded and who are not doing well, but still succeeded and they are earning well. So this is how. So this is
Yeah.
their mentality. We cannot do much to them. And you should try to ignore those people. And that's the best way I can tell you.
Okay. Okay. Thank you, sir. Thank you
Welcome.
so much.
Good evening, sir.
Good evening.
Sir, myself Janhavi Mishra from Banaras Hindu University, Varanasi. Sir, can you explain in detail about NABH?
Madam, see, NABH is an accreditation. That is a certification by a authorized body, right? So you get this certification if you are able to follow the standards set by them, right? Standards are some lines and requirements which have been prescribed, right? So if you are able to achieve that, automatically you will be given the accreditation, right? And this NABH, what happens is that it's a very long process where you have to develop the documentation, and after the documentation is developed, you have to record this documentation, and you should present before the committee, right? And then the committee will approve you. And to say it in a very, very short way, I don't have much, I think I don't have much time left. But if you can, if you want, yeah, I can WhatsApp you the details of this particular thing so that you can go through that. And if any questions are there, I will be ready to clear you anytime.
Okay, sir. Thank you so much, sir.
And right now, are you a doctor or a
Sir,
student?
I am a BNY student. Yes, sir. Fourth year.
Student, okay. Because right now there is an NABH course going on, supposed to be happening on 10th of August.
Okay, sir.
Okay, I don't suggest you that. Once you finish your degree, that would be better for you.
Okay, thank you so much, sir.
Yes, Bhavik, are we done?
Yes, sir. Maybe that's what we are waiting. So if one questions is there, we'll take, or then we will wind up this session, sir. So we'll wait for 10 more seconds. If anyone is there, to unmute and ask to, sir.
Bhavik, you
Good
can
evening,
put my
sir.
email ID. Yeah, yeah, please go on.
Sir, this is Moodadadir Shantara from Advanced College of Naturopathy and Dietetics Science.
Which batch you are?
Hello.
Which batch you are?
Sir, I am 2015 batch, sir.
No, I was not there at that time. Okay, tell me.
Sir, you are there. Okay, sir. Sir, just 1 month
Yeah,
back,
I
I
was
had
there.
a
Sorry,
case
sorry.
of, I got a case of dystonia.
Okay.
Hello.
Yes.
So I heard about dystonia, but I thought I heard about dystonia, but there was not proper treatment about treatment for dystonia. He was
Okay.
having dystonia since 10 years. So
Okay.
I told him, so we can give just a symptomatic relief. So there was not a perfect treatment for that. So just I told him, just do physical activities like exercises and take a proper diet. Like I just gave him diet prescriptions, that and all. So how can we do treatment for him? So like what and all treatment we can do?
See, first be very clear whether it was muscular dystrophy or only dystonia. What happened about the
Sir,
CPK level?
Sir, I studied his case history, which already done previously. So it was cervical dystonia, what I read in that. So I thought to do acupuncture for that, but there
you
was
just
repetitive movement was there. So that's why I avoided that. So what we can suggest for them?
first have a check on this is CPK levels. Okay,
Okay, sir.
if it is
Okay.
CPK level, right?
Okay.
If that CPK, if that is higher, avoid exercises. Then
Okay.
if it is not, it is on the normal side. What you can do is that you can give, if there are repeated movements, you can give the same acupuncture point for ticks which are there,
Okay.
right? You can try
Yeah.
with that, because you can try with that. And next thing is that you can put his mind into the activity. For example, lifting up the hands. Does he have
Okay.
difficulty lifting up the hands?
No, sir, he was not having any difficulties.
Then
He
what
can,
difficulty is having?
but he just repeated movements he was having, and
Repeated
he
movements of
can't
what?
arms and hands. He was repeated, and the neck also repeated movement was there, and there was slurring of speech. Repeat this was difficulty in breathing. Everything was there.
So you try to treat him with acupuncture. Acupuncture is a better alternate. Okay.
Okay.
Then practice of yoga can reduce his anxiety. Particularly, you try to look at a treatment called as way neck or torticollis.
Okay.
Right?
Okay.
Look into that,
Okay.
or to look into the treatment for ticks. That may help you out.
Okay. Okay, sir.
And if you want further help, you can just contact me. I think Revati will be having my number if you are there still at Alvas.
Okay, sir. I have your number, sir. So I will
Please
contact
contact
you.
me. Tell me, give me the details. I'll help you out.
Okay, sir. Okay. Thank you.
Thank you.
Thank you, sir.
So there is a question from Dr. Sonali, I think so. So can you ask, like I'll ask you, sir, about the link of the course which is going to happen on 10th of August.
I'll send the flyer to you. Sonali, she's from Maharashtra.
So if Sonali is here,
What's her
can
full name?
unmute and talk.
I'm from
Sonali,
Gujarat, sir.
Gujarat.
Yeah. Okay. Have you finished your degree?
Yes, sir.
Okay. Then what I'll do is that I'll put the flyer into queue to Bhavit, right?
Yes, sir. I'll
Or
share
send
to.
an email to Bhavit. Okay. He
Sure,
will
sir.
forward that to you. And you can contact Dr. Neha there. So in NABH, there is a numbers also. You can contact there and you can apply for that.
Thank you very much, sir.
Welcome.
So thank you so much, sir. We'll conclude the session because as we have decided and we have fixed for 1 hour, so we have crossed more than 5 minutes, but still we have taken every questions which they have the doubts from on the accreditation part, on their journey, on their anything, whatever they have, and still I'll share your email or your details. So if there any doubts are there further, they can contact you, they can reach to you. And
Right.
thank you so much, sir, to come on this platform. And we are looking forward for next session whenever it has having for more to talk on accreditation part. So people can learn and open their clinic with this accreditation, so no one will blame them with their quality of practice and their quality of hospital. So thank you so
It
much,
was a
sir.
pleasure to be with you, and it will be a pleasure for me to introduce them to NABH because I believe in quality.
Yes, sir. Sure, sir. Everyone, if we believe on these quality aspects, maybe our system will not be blamed by anyone. So we can stand on our systems. That should be.
Right. That's
So,
it.
so thank you, sir. And thank you everyone to join this session. I hope everyone will learn from this. Thank you, sir. And thank you, everyone. We'll end this session.
Thank you, Bhavit, and thank you everyone for all those participants who have attended this this thing. Thank you.
Thank you, sir.